Welcome. We really appreciate you all being here. We have nurse practitioner Deidre Arms. She is with us today, and we are again talking about the nutrient deficiencies, many nutrient deficiencies that are stemming from, many of the cardiovascular and vascular medications that we take. In past shows, we've been talking about magnesium, we've talked about vitamin D, we've talked about vitamin B. But today we're going to open up a big can of worms. We are going to talk about potassium. So, Deidre, first off, I think this is where we need to start. What is potassium and what does it do for our body? Great place to start.
That is a great place to start, Kim. And potassium is one of a vital mineral and electrolyte that helps our cells, our nerves, muscle function correctly. And so it plays a crucial role in maintaining fluid and electrolyte balance in the body. So very important for cardiovascular disease. Potassium regulates our heartbeat, muscle contractions, and nerve signals. And additionally, it's also involved in metabolizing your carbohydrates and synthesizing proteins. So you really want to balance the potassium to also help with your blood pressure. So that's a big thing with cardiovascular disease, and it can help with preventing cardiovascular disease.
So what causes a potassium deficiency? I assume you're going to include also some of the medications as well.
Yes, I am. So can be insufficient dietary intake, so not consuming enough potassium-rich foods, or if you have excessive loss of potassium. So think of like when you're feeling ill, you're vomiting, diarrhea, if you have excessive sweating, and those diuretics. So that's one of your medications that potassium waste. And then medical conditions such as kidney disease, that can cause you to lose too much potassium as well. And those meds, particularly to treat hypertension, heart disease, they can cause the body to excrete more potassium than usual. And specifically, if we want to get into what meds, like I said, diuretics, because those are often given to people for their blood pressure, right? And it increases your urine production, and that can lead to loss of potassium that way. Sometimes laxatives, if we're having to use that for constipation or chronic constipation due to medications that we're on, it can cause some excessive potassium loss as well. Your corticosteroids, which is used to treat inflammation, that can alter that potassium balance. And then some penicillin antibiotics is another one that can affect potassium levels as well.
Does potassium deficiency have an official name?
Hypokalemia, yes.
That's a big word. I'd even prefer potassium deficiency, even though it's a bigger mouthful, because I'm not sure I could even say that.
Yeah.
So do you get, what are the symptoms of a potassium deficiency?
Okay, or hypo-K, we can abbreviate on here, right? So your potential like deficiency signs could be weakness and fatigue, which there's so many things that cause that. So we have to really dig deeper. Increase in your blood pressure. If you're having an irregular heartbeat, if you're feeling short of breath, you're having any numbness, tingling, muscle cramps, constipation, or increased urination, those can be symptoms of deficiency of your potassium as well.
So do you only get those symptoms if they're severe, or can you get them also when you have mild hypo-K?
So mild hypo-K really kind of presents very subtly. Symptoms such as fatigue or muscle cramps. You get more severe hypo-K, those symptoms are more pronounced. So that includes that severe muscle weakness, paralysis, your irregular heart rate, even respiratory issues. So the severity of the symptoms typically correlates with the level of potassium deficiency there is.
Can it lead to sleep apnea?
So there's not a direct evidence linking potassium deficiency to sleep apnea. However, it's vital for muscle function and nerve signaling. So severe deficiency can affect the muscles involved in breathing. And it can exacerbate conditions like sleep apnea, but we need more research to definitely link it.
How do you test for the potassium deficiency? Is it blood? Is it urine? Both?
Well, we typically test through a blood test. So we can do a serum potassium level, just drawing your blood there. In some cases, we'll do a 24-hour urine test. They might need to conduct that, your provider, especially to see if you're excreting it through by the kidneys more. Most of the time we do it in just your comprehensive metabolic or just draw potassium on its own through a blood draw.
So who should be tested for a potassium deficiency? You know, especially if they're not showing the normal signs and symptoms. You had mentioned that there are some medications, there are some things that can lead to it. So what are those risk factors and who should get tested even if they don't experience any obvious symptoms?
So people who are at higher risk for potassium deficiency, such as people who are taking diuretics for their disease state, people who have kidney disease, if they're experiencing chronic vomiting or diarrhea, they should be tested. Routine testing, like what we do on your annual, it might not be conducted if you're not symptomatic, not having any symptoms at all, unless you're at high risk or you have any underlying conditions, or if you have medications that are potassium wasting.
Have you found doctors or clinicians to be resistant to testing for potassium if a patient asks for it or thinks that they're at risk?
I feel like no, that's probably a very simple one that easily clicks in the head to like, yeah, that should be tested, you're right. Because it is in the comprehensive metabolic panel, which looks at kidney and liver. So potassium's in there and that often gets drawn. So I feel like that one is a test that many providers are doing.
What is the treatment? So you find out you have potassium deficiency. What is the treatment for it?
Well, it typically involves either, depending on the level, a dietary adjustment, right? We want to be eating those potassium-rich foods. Sometimes, though, you'll need an oral supplement of potassium, and your provider can write for that. It's very inexpensive to write for potassium and to use that. And then for severe deficiencies, when people are hospitalized, they may need IV potassium, but that's not everybody. And really, Dr. Google says that they don't treat for low or mild deficiency, and let me tell you why. So the mild potassium deficiencies can often be managed through dietary without the need of supplement or medical treatment. And this helps to minimize risk of overcorrection, which can lead to having too much potassium. So that's called hyperkalemia. So when when you Google it and it says they don't treat for low or mild, that's why, because we don't want to overdo it when it comes to potassium. It really has to be a good balance.
So what can you do independently to help improve potassium levels? You mentioned that diet is a pretty big deal that could lead to potassium deficiency, that eating the right stuff, maybe potassium-rich foods might help.
Okay, so we've been talking about eating the rainbow these last few weeks here. So let's talk about the foods in the rainbow that can really help boost your potassium. I'm sure we've all, raise your hand, heard about bananas, right? But for some people, because of the glycemic index of bananas, we would want something lower glycemic. So let's start out with our red tomatoes. Have potassium in it. Our oranges have potassium in it. Sweet potatoes have potassium in it. Your spinach, your beans, salmon, gotta love some good salmon here. Yogurt and avocados. Can't forget the great benefits of avocados.
So when should you decide to actually take a potassium supplement?
It really should only be used when it's recommended by your healthcare provider. You really should have that level tested and have them recommend it. If dietary changes are insufficient, or if you have a condition that causes significant potassium loss, then let them prescribe you potassium as well.
And if they do prescribe potassium, do you have any sort of criteria to guide us in choosing one, or is that something that our healthcare provider does?
So our healthcare provider can do that, or they might say supplement with one over the counter. And so I can speak to supplementing over the counter and some various things. So when you choose a potassium supplement, you want to consider the form. So there's many forms. Last week we talked about all the magnesium forms. Potassium's a little bit lower on that, but you have potassium gluconate, potassium citrate, and potassium chloride are the common forms that we see. And the dosage, you want to follow the healthcare provider's recommendation closely to which dosage that you want, like how many milligrams that you need. What you're looking for in quality are reputable brands. So if you're buying something online or through a supplement store, I would look at those better brands of things that have high quality sourcing. And then additives. Choose a supplement with minimal additives or fillers. That's really important because that's why so many people don't tolerate a certain generic med versus a brand. It has to do with the fillers, and that's the same way with potassium. It's the same way with supplements.
It's always hard to know when it has fillers, when you can't even recognize the names, in the first place, because they always have these highly clinical names of even of the supplement itself. So I don't know about you, but sometimes I get a little confused.
No, that's so true. It's really confusing. Some of the top brands that you see that are high quality, good sourcing, if you're supplementing, that's not a prescription. What you can look for are brands like Pure Encapsulations, Orthomolecular, Metagenics, Designs for Health. Those are all really highly sourced, high quality supplements as well. And you can definitely speak to a healthcare provider about those. So.
How long should you take a potassium supplement? I'm sure that our healthcare team is going to guide us, but what's typical?
It really is going to be based on the individual needs and the underlying conditions. So if you're treating somebody with a potassium wasting, like diuretic, they may need to be on it longer term. But if you're just somebody's not getting enough through their diet, it may be shorter term, like a month. Some people are on potassium continual when they're taking those medications as well. So it could be short term until levels normalize. You'd want to have it rechecked, but longer if they have this chronic conditions and ongoing losses. So.
And how often, so if you are on a potassium supplement, and I would say even if you're not, but you might be at risk, how often should you get tested for it? Is this something that you can just say every time you have your annual physical, maybe just ask your primary care physician to add it to the blood panel?
Right. So for a person who is not suffering from any sort of cardiovascular or on a diuretic, and you're just going to your annual wellness, probably yearly would be adequate. But if you're on a medication and a potassium sparing, or you have kidney disease, more than likely, at minimum, it's probably every 3 months that you're getting checked for this. And it could be even, sooner. It depends on how the condition changes and everything.
How often do you find people with potassium deficiencies as compared to other deficiencies? Or do you find them combined typically with another deficiency or multiple deficiencies?
I would say it's probably combined. The top deficiencies that we really see with medications and stuff, like we talked about magnesium, we talked about vitamin D, potassium, and especially those meds, if you're on them longer term, potassium is one we really are concerned about with cardiovascular disease because we want that balance.
I know for me, since we've started doing these sessions, I've actually upped and been more regular on taking my supplements and paying more attention to some of my blood work. I've actually gone back to past blood work and I've noticed certain deficiencies that my primary care physician never even discussed with me. And it blows my mind that when you're just right there at the low end or just below or at the high end or just above, they just don't discuss it with you. And I really don't understand why. And it becomes frustrating. And we wonder why people end up with these chronic illnesses. And these doctors sometimes just don't put two and two together. And I'm sure you find that when a patient comes to you and you're in private practice and they say, I'm just not getting any better. I don't understand. You see the blood work. Well, did your doctor tell you you had chronic kidney disease? Did your doctor tell you you're deficient in vitamin D? And they're like, what?
Yeah. Well, I sometimes think we treat patients in silos, right? In a traditional model. So you've seen the primary care, they're supposed to be the gatekeeper of that silo, right? And kind of give you an overall of what those labs are. But let's say like it was your endocrine who drew a lab and then your cardiologist and then your urologist. And so each person is looking at the other to make the decision about that. So you're very treated in these silos. And I think that it is probably part of the problem and the time. We are in a healthcare model that doesn't give us enough time to just sit down and be conversational and relational with our patients. So.
No, you probably don't have 30 to 50 patients in a day.
No,
with
we
10
keep it
minutes
very
apiece.
minimal. Yeah. I used to do that. For sure. So, and I had some information for you
What
on
was the catalyst for you going into
private practice.
What was
So
the catalyst for you
it was my open heart. So
private?
yeah, it was my open
Oh,
heart,
was it?
and yeah, I was just hugely led. Like I have this second chance at life, and I want to have joy in it. I want to care for the people in the way they should be cared for, and that was the catalyst for me. So
And you want to care for yourself.
exactly, and you can't do that as well in seeing a patient every 10 minutes, right? There has to
No,
be a
that's
balance.
pretty hard.
Yeah. I can think more
So,
clearly and help more people if I can keep my stress down as well.
mhm. And you said you have some more information for me about
Yeah.
something? Yeah.
Yeah, I have the various different types of the potassium, like we kind of went through with the magnesium last week, just so you kind of know, because you'll look at those big words and be like, well, I don't even know if this is the kind my doctor would tell me to do. And so I just wanted to describe those three that we talked about, the gluconate, citrate, and the chloride of the potassiums. If, if that's okay with everybody, we're gonna potassium gluconate. So that's a potassium salt and of the gluconic acid, and it's found in your dietary supplements. It's easier on the stomach. So if you're looking for a supplement that's more gentle, slower releasing manner, that's one that can be really helpful. That one's found over the counter, and it's suitable for people with need a gentle potassium boost. So this might be one where they say, hey, this is where you need a little bit of supplementation, not for a long time, but potassium gluconate is a good one, very gentle on the stomach, and you can take it with or without food. Then the potassium citrate, it is potassium salt of citric acid, and it's actually used to prevent kidney stones and for certain types of acidosis, and that's something, a balance that we're looking for in the blood. It helps though to keep urine less acidic, and so people who have kidney stones, this would be a better option for them. And then the potassium chloride, this form is the one that we see most written for by your providers to treat hypo-K. And it helps to raise the potassium level much higher makes it effective in treating those acute deficiencies. Widely available, cost effective. And that one is oral and IV form as well.
And, with these potassium, I just want to reiterate that you really need to not overdo on the potassium, correct? You really want to make sure that you're getting it monitored when you're on the potassium, that you're getting regularly monitored by your provider to make sure you're not taking too much.
Exactly.
And is there any potential that if you are taking that regular and you are eating the potassium rich foods, can you get too much in doing that?
You probably would get more or too much from the supplementation versus the potassium rich foods, I would say. That's kind of where we see the bigger hyperkalemia come out of if we over supplement as well.
So you don't have to worry about if you are taking the potassium supplements, you don't have to worry about how much potassium rich foods you're actually eating.
Well, let's talk about the need for a second. So if you are a male, and I'm going to pick age 51 and older, so about 3,400 milligrams is needed, and a female is 2,600 milligrams. And so when we talk about our foods, we talked about looking at a banana. The one medium banana only has 422 milligrams. If you ate apricots, like a half cup, that's only 755. If you did prunes, 635. Your kidney beans, a cup of that is 607. So when you're looking at eating the right foods, eating the rainbow, you really need to eat quite a bit to get the adequate of potassium that you need.
Do diabetics need to be a little bit more careful with eating potassium rich foods, especially when there are so many fruits or there are a lot more vegetables?
So I would look at the protein part of that, the kidney,
the protein part.
beans, things like that, your soybeans. We also talked about salmon as one, your green leafies. So those are other things that we can add in that are potassium rich. But you're right. Like I said, that banana is a high glycemic index. And so if you're really struggling with your blood sugars, you really want to watch what you're eating, even when it comes to fruits that can convert to sugars as well and increase your blood sugars. Monitoring with a continuous glucose monitor is always helpful for that.
And Alter Ego Kim is asking, what's over supplementing feel like? What are the symptoms of hypo-K?
Symptoms of hyper-K? Okay. With many things, they're very similar to the hypo. For that would be, again, those mild symptoms of fatigue, muscle weakness, heart palpitations. So when you go too far either way, you can have the same symptoms, but with the hyper-K, we have to be really, really mindful of kidney dysfunction, right? Because we can reduce kidney function or have kidney failure as the body excretes too much potassium there. Another thing that can cause that high K here would also be like your ACE inhibitors. That can be another one that can cause you to have hyperkalemia as well. So.
Isn't potassium something that a supplement that, or a nutrient that can actually, if with chronic kidney disease patients, they need to watch it because that can lead to plaque buildup in their arteries? I had read that somewhere. Yeah.
Yeah. And then when you're thinking about having too much potassium in the blood, we're thinking cardiac arrest can happen, or severe arrhythmias as well. So, you do have to have a good balance of that. And so those conditions where your kidneys aren't functioning properly.
So especially if you are a chronic kidney disease patient, you really need to, your level of potassium in your body is going to be different. It should probably be more on the low side versus on the higher side.
Yeah, and that range can be different.
For
And
each
every
person.
lab has a different range that they use, but typically we're looking at a range, most of the time under 4.5, so that kind of 2 to 4.5. It just depends on the lab.
And that's such an interesting point that you brought up about the labs having different ranges. Would you mind explaining that? Because I learned that recently, and I had two different test outcomes, and I was like, I just don't understand. Oh no, you're still normal because we just use different ranges. I'm like, well, isn't high high and isn't low low?
So let's explain that a little bit differently because it is so confusing for patients. They look at something and they think, I had this high number here and I had a low number on this lab, and why is that happening? And really getting into the nitty gritty of things, the methodology. So labs often have different reference range for various tests, including potassium due to several factors. So it could be, are they doing analytical techniques or are they doing calibration standards to calculate how they basically decide the range for the lab? And then for some labs, the reference range are often established based on a population that the lab serves. So that has to do with your genetic background and other influences like lifestyle and diet. So certain populations, certain labs, they have a range based on what they're seeing in their environment, like what is normal for this genetic background and this type of diet lifestyle that people have. And then they use reference ranges that can vary between labs because you're looking at sample sizes of the reference range, like how many people have done the studies for it as well.
I can definitely see holes in that.
There's lots of holes in that. So it's just crucial to interpret the labs based in the context of the specific lab's reference range. And that's what we do. So for like lab A may have potassium reference range of 3.5 to 5.1. Our lab here is like a 3 to 4.5 that we use. You might have another lab that's 3.6 to 5.2 is your reference range. And so it really has to do with using that lab specific reference range because it has to do with how their quality metrics and their methodology to collect it and how they decide what that range is.
Sounds confusing to me because I would just think that, okay, this is my A1C, it's supposed to be X, and I would think that that particular number, no matter where you go, would be high, or it would be low, or it would be normal.
Right. And it does get really confusing for patients, even clinicians as well, because if you've moved from one hospital to another or you're looking, you get in your head the things you see often and you get really good at looking at. But it's crucial to interpret labs really in the context of that reference range. And I often say, we're a private practice, we do functional medicine, and I often say, just because it's within the lab range, is it optimal for you? And that's what we're looking at. What's optimal for our patient? So,
And that's actually what I look at too. When I see certain ones now, where it says that my vitamin D is normal, but it's on the real low end of normal, I know I need to still boost my vitamin D because I want to get up into what I feel would be a more safe level.
right. And
And
so looking at what's the best for you based on what your medications are, what your clinical picture looks like, what chronic conditions do you have?
Yep. And Douglas wants to know, how can I tell if I'm getting enough potassium?
That would be through a lab draw, Doug. You definitely want to, if you're eating potassium, you may have had a recent comprehensive metabolic panel or a CMP, and it would be in that, or they can draw just a potassium level. And that'll let you know what your level falls in and if you're getting enough. And then you can decide based on how low it is or how high it is, do you need to supplement or should we just include more foods that are potassium rich?
So
And
can I ask something? So like green beans, is that one of them, or is it just like the green foods? Because I eat a lot of spinach.
Do you? Okay, so that's a good one. Spinach is a good one. Let me see how much potassium here is. I don't know it off the top of my head, to be honest, how much potassium green beans has. What other kind of foods do you like? I know you do a really good, well-balanced diet, but were there any others that,
Artichokes, like that. The
do you do
long green
avocados?
avocados, uh, cucumbers.
Okay, okay. And so the green beans has about 100 grams and a 3.5 ounce. So some of those other ones have more bang for your buck, per se, if you're really trying to up your potassium. So lentils, that's a really good one. 1 cup of lentils has 731 milligrams per serving. And then when you look at green beans, it's only 100 grams per serving as
and what's
well.
great about the lentils, if you get the red lentils, I don't know if it varies based on which lentil you get, but I know the red in terms of the nutrients, but I know the red lentils that if you put them in your Instapot, with your broth or water or your chicken and veggies and that kind of thing, they melt and they make they make it into a thicker, at least a creamier soup. So it's a little tip. So you're not actually eating the lentils. It's blended into the broth and it turns into a creamier broth, a little heartier.
Nice. Haven't done it in my crock pot yet, so
Just
maybe that's something I should.
and
Should we
Marcia
call
is
this cooking
asking.
with Kim?
I always joke if you do it cooking, it's KOOK, cooking with Kim.
Yeah, you have such great tips every week. Oh,
Hey, I'm learning as I go. I watch a lot of Instagram and YouTube influencers. And in fact, next Friday, a week from Friday, we're going to try something new. And I'm going to, since I do follow so many different influencers and their cooking, I'm going to try to follow some of their recipes. And there's one called, um, goodness, Low Carb Love. That's what she's called, Low Carb Love on YouTube. And she
okay.
has this easy, amazing chocolate cake with 3 ingredients, no sugar. And I even ordered the chocolate chips that she suggested, which no sugar. It actually uses the Buddha fruit extract. And I think it'll be interesting. So you should actually join us. I'll share the recipe with you. It's on our YouTube, youtube.com/the way to my heart. Under the live section, you can see that the promotion is there already for next Friday. And we're going to try it. So anyone who wants to join and cook a healthier chocolate cake recipe and make me look really, really bad, because any one of you is going to cook it better than me, I think it'll be really fun. So it's just a few ingredients. It shouldn't take too long, except for the baking. And maybe while it's baking for those 20 minutes, maybe we can all just chit chat and have a good time.
Nice, nice. And what day, what Friday?
It is a week from Friday. Maybe our
Okay.
producer Josh has the exact date.
The 19th, July 19th?
That's it.
Good. What time,
And
your
then that
time?
is July 19th. I think it's 3 o'clock Pacific time.
Okay.
So 6 o'clock Eastern. I wanted to have enough time so I could taste it and have it not interfere with dinner. So I needed a little extra hour in between. And so for me on the West Coast, those of you on the East Coast, you're just out of luck. You're just going to have to eat it with dinner.
Yeah,
Or
this will
maybe
be
either
our
early dinner.
after dinner dessert, right?
But it looks really good. All of her recipes at Low Carb Love look really, really delicious and very easy to make. There was another one that I saw, and I don't remember the influencer. I was debating with my producer, Josh, which one I should do. And Josh, I think it was the dark chocolate chips from the same producer and apples. And it was making, I think, brownies. Yeah, it was apples. So it was chocolate chips and apples. Oh, and eggs. Eggs, I think. No, maybe it was 3 ingredients. So maybe it was eggs. I can't remember. I will have to go back and look, but I think we'll make the next chocolate recipe the next week and then we'll compare the two. But it's
Cool.
supposed to be healthier. But you talked about how healthy apples are, so.
Right, they are. So,
But Marcia had another question, going back to potassium. She wanted you to just see if a lot of what you were talking about with the types of potassium were a little clinical. Is there any possibility of breaking them down just a little bit? Or
yeah.
for a patient, like, do we need to understand them, or do we just need to know that one's easier to take than another?
So I think like if you're looking to break it down in just really simple terms, let's go back to those. So your potassium chloride, that one there, that one is more for acute deficiencies that we see. Your provider can prescribe that one for you. So it can be prescriptive, that potassium chloride. Potassium citrate is usually given if you have kidney stones. So it's really meant to help with kidney stones and certain types of urine acidosis or basically from the kidney stones there. And then the one that's really easy on the gut that can be taken if your provider says that it can be is the potassium gluconate. And that's one that you can buy over the counter, that's easy on the stomach, that is meant to give a slower release and increase your potassium level through supplementation. So if you do not have kidney stones and you're not treating that, the one that you would probably look at would be the potassium gluconate.
But always make sure that you do have the blood work to support taking the potassium supplementation in particular.
Exactly. Yeah.
That's not one that you can urinate out, as we always discuss, like, for example, with vitamin C and vitamin B.
Right. So,
And Marcia, do you want to jump in? Maybe not. She says, what I meant was, how can we incorporate potassium regularly in our diet for increased health benefits? How does low potassium affect PAD patients as well in particular?
okay.
So those are two different questions.
Thank you.
Okay. So incorporating it in your foods is finding something like a potassium rich food that you like. And you can do like a potassium rich quinoa salad, right? So quinoa is great. Adding like the quinoa, some sweet potato maybe that you've peeled, roasted, some chopped spinach can be another, adding a little bit of avocado, black beans, some of the cherry tomatoes, your peppers, your red onion, a little bit of olive oil and some lime there and garlic. And then you've got you a nice salad that's really rich in potassium that you can add to what you're eating as well. And then you can add a little bit of protein and make it a full meal, right? So, and what was the other question?
It was in regards to how does Go ahead.
Sorry, I couldn't find my mute button. How does, like, if we're not getting tested for low potassium, I guess what I wanted to do was take the conversation so that we as patients can, you know, benefit daily from all this good information. So how do we know, unless we're being tested, that we have low potassium? Like, how does it affect a PAD patient? Is that what
So
it was, Kim? I can't remember.
So you really don't know until you've been tested, right? We can base some of the symptoms, like we were talking about, feeling fatigue and muscle things, but that could be other deficiencies as well. And so when we're looking at like how can we optimize our diet, and so not only do some of the things we talk about in the diet like quinoa, and they're also high in protein and fiber, and you have essential amino acids. So really looking at your diet, in effect, 7 to 10 colors a day should be added, getting that diversity so you get the micronutrients that you need. But really, the symptom is what gets us into the office to get the lab test, right? But we only know if we test exactly.
Is it true that I can remember one time, well, I've had Charlie horses. I'm sure we all have at one time or another, but I remember one time in particular, I was driving and I got a Charlie horse in my right foot, which, I was using to drive. And I had to pull over. I mean, it was so bad. I had to pull over. In an instance like that, is it a good, they always say, well, eat a banana or something. Of course, I didn't happen to have a banana in my pocket, but is that a true sign of a potassium deficiency, or does it help if you have a Charlie horse to eat something with potassium?
So muscle cramps and spasms can be a sign of potassium deficiency. They also can be a sign of magnesium deficiency. So you could be depleted if you're getting muscle cramps and spasms, and especially regularly. You want to have those levels tested and look at that, but also making sure you are getting the foods that are rich in potassium, rich in magnesium in your diet as well.
What's interesting to me is with so many of our PAD patients that have been told, and numerous, too many to count, have been told that when they've come in and complained about their muscle cramps, they just go home and eat a banana, go home and hydrate, go drink some pickle juice, whatever it might be. But it's so easy for them to test for it. I think it's important for people who are listening right now that if they are getting brushed off and doctors saying, hey, it's just potential deficiencies. Well, you know what, doctor? Test for it. Show me the blood work. Let's get that blood work. Let's get that lab.
Yeah. And that's where individualized care comes in, right? You want this to be specific to your needs. When you walk out of that office, you want the treatment that's given to you to be very specific to your needs, right? So we can generalize what you need for potassium and what will help with muscle cramps, but do we actually know that's what you need, or is it something else?
We have a question from Mimit Health, the Midwest Institute for Minimally Invasive Therapies, coming in on our YouTube channel. Thank you so much for watching. I know our crew out there in the Midwest absolutely love them. Many patients have gone there. Wonderful doctor out there who's just a wonderful human, Dr. Chopra. What role does potassium play in those with type 2 diabetes?
So type 2 diabetes and potassium. I always think of, first of all, we have an increased risk of having hypertension with potassium. So we really want that balance to be there. Some of those diabetic meds also can be a problem with your potassium because you're put on many meds. So insulin and potassium regulation, insulin helps to pull or move potassium into the cells, and people with type 2 diabetes or insulin resistance, this can impair that process. So they have trouble with that, and it can potentially lead to an elevated blood potassium level. So when you have insulin or blood sugar dysregulations, you're not moving potassium like you're supposed to. And then those medications used to treat your diabetes, ACE inhibitors is one. Most people, when they're found to be diabetic, not only are they being put on a diabetic medicine, but they're also being put on an ACE inhibitor even without high blood pressure to protect the kidneys as well. And that can affect your potassium levels. So you have the dysregulation with the insulin and you have the dysregulation with the glucose, and now you possibly have a medication that's causing that as well. Diabetes does lead to kidney disease as well. So that's, a known complication. And when we have impaired kidney function, then we have trouble maintaining our proper potassium balance.
A moment ago,
And
you were
Marcia has a
saying,
question.
yeah, a moment ago, you were saying how, like bananas are high in sugar, or I think that's what you said. I don't want to
Yeah.
misquote you. So are many foods that, as far as the last question and about diabetics or type 2s, I'm pre-diabetic. So are a lot of the foods high in sugar that are also high in potassium, or carbs, which turn to sugar?
Right. So there are, some of them are higher in carbohydrates as well. So you do want to monitor your blood sugar when it comes to that. You want to know what foods are affecting your blood sugar. We talked a few weeks back about the sequence in which you eat can also help slow down a glucose spike. And so getting the vegetable piece of that first, so those lower glycemic vegetables in there, followed by a protein, and then any carb last, which can be the acorn, squash or your potato or your kidney beans. Like those are a little more higher in the carb, but it doesn't mean that you shouldn't ever eat carbs. We can eat them in a sequence that can be very helpful to our, blood sugar while getting the potassium. If you have the option to get a continuous glucose monitor from your provider, I always recommend wearing it for a couple weeks and knowing what's really spiking your glucose. And I've heard soon this will be out on the market for anybody to purchase one and wear, even if they can't get it as a prescription. So
Good to know.
Yeah, that'll be fantastic. And it's important, again, to recognize that a lot of diabetics, type 2 diabetics and type 1 diabetics, they do have some kidney issues. And so chronic kidney disease, we find that a lot. And so, again, it's really important that use your insurance and use your care team. Go get a referral to a dietitian, get a referral to a nutritionist, and find out, ask them to do the blood work. Say, hey, let's find out what deficiencies we have. And then tell me what foods in the rainbow I should be eating for my diet, for me, especially if you do have those additional comorbidities of diabetes and chronic kidney disease. It's really important to understand what is right for your particular presentation.
And a few tips for diabetics also: monitoring the blood sugar and the potassium levels. So you want to look at those regularly. And so it's not unreasonable to think every 3 months you should be getting an A1C and a potassium level drawn as well. And just balancing your diet to include those vegetables and fruit, and be mindful what you're taking in as well. And for kidney function, hydration is important. So we really want to watch that in diabetics and have adequate intake of your fluid as well.
Yep. And then you have the other side of it with the chronic kidney disease patients that have to, have a little bit less. They have to really monitor their hydration very, very carefully.
Exactly. So just watching what is needed individually. That's why you are all very unique people. We all are. And so I can't say it enough, when you walk out of the doctor's office, you should feel like it was tailored to you, what they've decided to do, and it's specific to your needs.
Thank you. Thank you so much, Deidre. We just appreciate you so much. And next week, we're going to be talking about iron deficiencies, which we see so much in especially cardiovascular and vascular patients. And I just found out I even have iron deficiency. So I can't wait to ask you questions about my situation as well. So everyone, come armed for Deidre Arms when she talks about iron deficiency next Wednesday at 4:30 p.m. Eastern time. If there aren't any other questions, any other comments in regards to potassium before we close off this session? No? Okay. Well, thank you so much, Deidre. We really appreciate you. And I want to just make sure again that everyone understands that Desire Wellness with Deidre Nurse Practitioner is a series designed for educational and informational purposes only. And any advice offered is not to be considered a substitute for medical advice from your own supervising physician. Do not act on any information or advice provided in this series without the explicit consent from your own healthcare team. It's really, really, really important to understand that different people have different dietary and supplemental needs based on their own body's chemistry and presentation of disease. So make sure you do ask your own healthcare team for a dietitian or nutritionist referral to find out what dietary choices and supplemental choices are right for you. And with that, thank you so much, everyone, for joining us. We really appreciate you. Have a great rest of